Scotland is Divina Morales. Divina is also a nurse, and she's currently in isolation. Divina, how are you?
I'm a bit scared, to be honest.
Okay. Can you tell us what is your situation right now? Why are you in isolation?
Okay. There's somebody who lives with us who works in a nursing home, and she was exposed to COVID positive patients and staff. One of the nurses there, a Filipina, is currently in ICU because of COVID-19. So at the moment, she's on isolation plus other Filipino nurses. And as a protocol, we have to observe that once somebody lives with us, has got the symptoms, then we also have to isolate ourselves. And it's actually longer than the one with the symptoms herself or himself. Because she's on isolation for 7 days, but we will be on 14 days, lest we get the virus infection later.
Okay. So it must be a scary experience for you. But you seem to be well. Are you showing any symptoms at all?
Oh, no.
Okay.
Apart from her, we don't have any symptoms, neither my husband nor I.
That's good.
And it's a good thing that we all work in a healthcare sector and we know how to observe precautions and to avoid cross-infections. So we see to it that she's isolated in her room. I prepare her food. We disinfect the common toilet after using. And then since we work in the hospital as well, we leave our shoes in the car and spray it with disinfectant. So we do as much as we can to not be infected.
So you know very much the rules since you are a nurse and you know what to do really. So do you have kids with you?
Actually, I have two.
You have two?
Yeah, my daughter is asthmatic, so she's also in isolation because of that, just in case.
Are they with you? Are they with you? Okay. So do they live with you or are they separated
now? My daughter is here,
now?
but my son is over there in the Philippines. Yeah.
Okay. So your daughter, so how do you take care of yourselves then? How do you, what do you do with your daughter since you can't really, what do you do? What do you do? How do you keep yourself separated? Yeah.
Well, it's a good thing that even prior to this pandemic, she's really a homebody. She gets her gadget, she plays in her room, and she talks to her friends here and abroad. So it's not that hard for her. And she only gets down when she gets her food. And also the one with the symptoms, I just put her food outside her door to be safe.
How do you prepare? Who's preparing her food then?
Well, it's as a mother, like it comes naturally that you have something to cook. But since we live here, they are used to like the Scottish breakfast, wherein there's an egg, a bacon, beans, and sausage, something like that. And then from time to time, I cook some Filipino food. And then, or sometimes they just eat cereals. So there's always the presence of the Filipino foods like adobo, sinigang. And when I have a chance to go to Asian store, then I can cook pinakbet. Yeah, all right.
Can you share with us your experience in taking care of patients in these times?
Oh, well, it's really like, let's say, really scary because the supply of the PPE is not enough. And I think the culture has something to do as well, that because they are not really encouraging everyone to wear masks even in respiratory wards, they really ran out of stocks. The irony of it is that sometimes you even find those PPEs in mental hospitals. And you know why? It's because they knew for a fact that some patients has the tendency to spit at the nurses. So that's why they have stocks. But the medical wards, they are not really that prepared. And it's hard because this virus, even if some people are asymptomatic, and then no matter how much you take care of yourself, observing the precautionary measures, the cross-infection, and really, if only the PPE are enough, then it will be more reassuring. However, it is not always the case. Because the health sector is not just the NHS. You know, there are care homes who cater for the elderly, and they are actually the ones which are more vulnerable. But it does help when you are really very religious with the constant hand washing, whenever, before and after you attended to a patient, and then you have to really protect yourself maximum, and then, of course, you have to boost your immunity system as well.
And
So
lastly,
you have to eat healthy foods.
that's right. Lastly, my
Yeah,
question to you, how do health workers there keep each other's spirits up during these trying times?
Oh, yeah. There are supports here anyway. There's plenty from the government. They have set up helpline. Actually, every Thursday, 8 o'clock in the afternoon. I think it is all across UK. We have that applaud. You know, they go out of their room or their houses, and then give applause to all the health workers throughout the UK. And that's to boost the morale. But then, as for the other sectors, like the shopping, the groceries, there are times allotted for the NHS staff, an hour before the normal opening. So that is entirely for the NHS staff. We're not doing too bad here in Scotland, actually. Even with the tested positive and with the death, it's not as bad as that. At the moment, we have confirmed positive of 3,706 and deaths of 220, which is not too bad actually, but still we're observing the social distancing even when you go to the essential shopping of your supplies. You know, you can observe it is like 6 feet apart, and then people are advised to stay home. And well, at the moment, by the way, at the moment, our chief medical officer has resigned.
Yes,
Dr.
that's
Catherine
true.
Calderwood.
Yes,
Yeah.
yes.
She resigned because apparently she's at the forefront of the NHS here in Scotland to advise people to stay home, and yet she's the one who violated it by going to Fife, where she has a second.
A similar incident here
It's a
happened.
holiday home.
Yes.
Yeah, twice that she went there, and then because of the protest of the politicians and civilians alike, she has no choice but to resign because she did not walk her talk.
True.
She's the first who violated it.
Yeah.
Yeah.
I wish I had more time, Divina. I would like to talk to you some more, but I will talk to you some more maybe tomorrow and the coming days. To our Filipino brothers and sisters there in Scotland, we wish you all safety, continued health. Thank you for your sacrifice in these unprecedented and interesting times. We applaud you just as much over here in our country. Mabuhay po kayo. Maraming salamat sa inyo, Divina.
Thank you very much. I'm Divina Morales, correspondent here in Edinburgh, Scotland. We live in interesting times.
Indeed.